COPD is a problem. COPD, called chronic obstructive pulmonary disease. It's a lung disease, chronic lung disease that affects 16 million people of our country has COPD, which is about 6% of the population. We know several things about the COPD because we know that smoking is a big risk factor for COPD. Previous lung infection, gases, exposure to fumes and gases, and secondhand smoking can also cause COPD. It's a disabling problem. However, it can be managed. There's no cure for COPD, but it can be managed. Think about a person who is drafted in NFL or NBA, is 24 years old. Very good lung function. That is the best lung function anybody can have at that time. That's how people get in the sports, in the military, and all these things. Normally, any single person will have a decline in the lung function as they grow older. So when someone smokes, it doesn't follow the pattern of the normal decline. Decline is exponential. It's a very large decline. Say, for example, a person who has COPD and 50 years old, he will have a lung function and lung capacity comparable to an 80-year-old person. So that's how the lung decline takes place. And the smoking is a big factor in doing that. How does the smoking do that? By definition, COPD has coughing and wheezing and a lot of mucus production. So there is a mechanism in our body, in the respiratory cells, they have a small apparatus called cilia. Those cilia actually constantly move and take the dirt and mucus out of our lungs. It's like sweeping your kitchen after you eat your dinner. And so smoking causes paralysis of the cilia, so they can't function properly. So as a result, there are a lot of mucus that collected inside our lungs that causes coughing and wheezing. So smoking is not good. So what happens with the symptoms? As I mentioned, that they have coughing, wheezing, and shortness of breath. How do we manage them? How do we treat them? The medication we call are bronchodilators. Broncho means the small tubes inside the lungs, and dilators mean that they open up those arteries, those tubes, and that's how the secretions are out, as well as people prevent or get rid of the wheezing. That's how they get better. Long-term use of inhaled steroids and few other medications called long-acting bronchodilators, as well as anticholinergic medication. They also do change the inflammation inside the bronchioles, and that helps with the COPD symptoms. So it's disabling, and it makes people lose their function. The way I described that a 24-year-old joining the NBA or NFL, and once people developed COPD, they're not able to do that. The lung function gradually declines. Say, for example, if somebody needs a surgery, for example, a gallbladder operation or an open heart operation, the COPD comes into the picture at that time. So whether the person can tolerate anesthesia, what's going to happen after they put him under the anesthesia, those discussions come up. If somebody has COPD, symptoms can worsen because of infections. Say, for example, if a COPD person has a little flu, that can actually tip him off, and that can take him to severe form of wheezing, COPD. We call it COPD exacerbation that can happen, that requires steroid, antibiotics, and other medications, and sometimes they need prolonged hospital stay. What do we do to prevent the exacerbation of COPD? That's very, very important discussion that we have in our primary care meetings with patients when they come for a follow-ups. Number one, if somebody is diagnosed with COPD, number one thing is please stop smoking. Number two is if anybody else smokes at house, please stop them smoking, or they can smoke somewhere else, not inside the household. If there is any toxic fumes or gases or anything like that, make sure that you're not exposed to that. Extremes of temperature, like too much heat, too much cold, avoid them. Bundle up when you have to go out, and make sure that there's a good temperature inside your residence wherever you live. That's very important. And then comes a very, very important factor that prevent infection. How do you prevent infection? We know that there are some bacteria and viruses, they cause infections, and we have preventive medicine for them. Like for example, pneumococcal pneumonia is one of the things that causes severe infections, and they can tip off somebody with COPD. So getting a pneumococcal pneumonia vaccine is very, very important. There are 3 other viruses that can cause respiratory infections, and they cause exacerbation of COPD, which includes influenza, COVID, as well as respiratory syncytial virus. So if one has COPD, those 3 vaccines should be taken. That is the prevention of infection in COPD. As people get older, the lung function declines. So it could be at old age as well. It's not known that what age somebody can have COPD because of the age. Some people get it, some people don't even get it. So regular exercise, right kind of diet, and make sure that the sleeping pattern is good, which means that there's one condition called gastroesophageal reflux disease. Sometimes that can exacerbate COPD. So sleeping habit is important here. If you have a good meal or a main meal, don't go to bed after the meal, and that can prevent you from getting exacerbation or even getting a COPD.